unfortunately, just eating clean and moving daily doesn't always work in menopause. For some, it might. So getting that protein intake, getting into the gym can really make the difference. But for most women, when your estrogen falls, there's some big changes in your body and your metabolism that make this just harder to do. It's just not this simple. And I wish it was, but it's just not this simple. The changes that happen, one change is your lean mass goes down. Estrogen and progesterone play a role in your lean mass, your muscle mass. That muscle mass plays a role in your basal metabolic rate. So the rate at which you burn energy goes down. So that's one big issue. Another big issue is that your visceral fat goes up, even if your BMI does not change. So you weigh the same, your fat changes from being more sub-Q fat to visceral fat. And so that visceral fat is more inflammatory, it increases your insulin resistance, and it increases your risk for other metabolic diseases. Okay, so it's an active inflammatory fat, also fatty liver. So there's a long list, but it's a different kind of fat and it's metabolically active in the wrong way. We also see increased insulin resistance. Estrogen manages glucose regulation. Okay, so along with that visceral fat change, estrogen itself manages how you use glucose appropriately. And so when that goes down, it is harder to manage your glucose, it's harder to manage your weight just separately as well. We also see that activity goes down in menopause, and this could be just related to age. As we age, we move less. But I feel like some women, when their estrogen goes down, they don't feel as good, they don't sleep as good, they're not, it's harder to work out because they're so tired or they're just not getting good sleep. And so physical activity goes down. So that's why physical activity is helpful during this time. But I have patients where they can't get to the gym because they can't get there because they don't have enough energy. We also see appetite changes, and we see like your actual adipocyte or your fat cell dysfunctional. So dysfunctional adipocytes, and that they're inflamed. And so then that plays a role, and it makes it harder for them to break apart and for you to lose them. So they feed forward on each other. Estrogen is very anti-inflammatory, and so when you have that sort of inflammation, it's harder to lose weight. All of these things increase your risk for metabolic syndrome. And insulin resistance is, what a lot of people believe as the fuel to the fire to a lot of the major chronic diseases: Alzheimer's, osteoporosis, cancer, and heart disease, and obviously diabetes. So we don't have a big count for people who die of diabetes, but insulin resistance is the fuel to the flames of those. And so when we think about the 4 major ways we die, managing insulin resistance is a huge component of preventative medicine and longevity medicine. So menopause is an inflammatory insulin-resistant state that, yes, is benefited by weightlifting and eating enough protein and having your diet organized and sleep and stress and all those things. But for some women, we need a little help, and we have these tools. And so if they're used in the right way for the right patient, they can be really great. And so if that's hormone replacement therapy to help you sleep, to help with the lean mass, help with you in the gym, and then also hormones have other benefits if you're the right candidate, and then a little bit of a GLP-1 if you need that. There's no shame in that, and it's a tool. And we're modern people, we use tools, and so it's a tool that we have. It's a peptide that has had a lot of data on it, and when done appropriately, I think it can be really great for the right patient. Menopause, not menopause, but that's why just eating clean and moving daily just doesn't work for menopause.